of cases of COVID-19, particularly in the South and the West. And I know Dr. Weston has obviously tracked this incredibly closely. And I would like to think that for some reason we're immune to this, but I don't think that that's realistic to think that we are going to escape the increase of cases. And so what we have to do is be very, very smart about this and try to continue to do what we have done in terms of social distancing and taking those protective steps that are necessary. To that end, we have continued to work with the health department along with the city attorney's office as we examine the appropriate way to go forward with a masking policy, in particular for restaurants, retail establishments, and places where you cannot socially distance at the 6-foot area. So one of the concerns we have, of course, is making sure that whatever we do is going to meet the legal requirements for putting forth such an ordinance, which is the route that we're looking at right now. Racine had done it through its health commissioner. That was challenged. The Common Council in Racine then, in essence, passed a resolution that delegated the authority to the health commissioner there. That was challenged as well. And at least at this point, it looks as though we are going to have to take more definitive steps. The whole purpose for doing this, of course, is to protect people. And when you think about the fact that 125,000 people in this country have already passed away because of COVID-19, every one of those people who died caught it from somebody else. Every single one of them caught it from somebody else by definition. And so when we talk about these protective steps, it's not as a punishment, it's not as a political statement, it's as a public health measure to make sure that you as an individual do not get sick, and equally important, that you as an individual do not spread the disease. I don't think there's anybody who intentionally is spreading the disease, and that doesn't bring back all those people who've died or all the people who've gotten sick. So what we're doing at the city is we're continuing to work on the webinars. The successful webinars that we had last week have been, I think, a template for us. Tomorrow we're going to be working with Safe and Sound and other groups to have one that talks about summer activities for kids and what we can do there. And that will be, again, you can go to our website if you want to sign up for that one. That's for outdoor activities, youth activities over the summer. And then Thursday we'll be doing one with contractors, people doing work around houses. And we'll have representatives from the Housing Authority, from city departments to talk about the special care you can take in those situations as well. So again, you can go to the City of Milwaukee Health Department and they'll steer you toward those webinars, and those have been successful. But as we head into the weekend, again, every single one of us wants to forget the fact that we've had this pandemic for the last 3 months. But that's the worst thing we could do, because we know, again, just listening to Dr. Fauci today and his concerns that we might see even greater numbers of cases because people have gotten so lackadaisical, makes it even more important that we continue to let people know how important it is to take safety steps. A couple other points that I want to make. One having to do with the National Guard. As we've said previously, the National Guard will not be testing July 2nd through the 5th. And that is because these individuals have been working very, very, very long hours over the last few months, and they're going to have other things they need to do around the 4th of July in terms of their professional activities, but also to give them a little personal time for their families. Many other testing sites probably will be down for the 4th of July, but if you feel a need to be tested, and again, particularly if you're someone who's been involved in one of the protests, if you've been outside a lot with other people, if you've been in contact with other people, please call 211 and get tested. It's very, very, very important that we continue the aggressive testing. The numbers have gone down, but when I say the numbers of people tested has gone down. We've seen an increase, and Dr. Weston can talk about where we are in terms of the positivity rate. But it is still very, very important for us to have people tested. So with that, I'll turn it back to you, Catherine.
Thank you so much, Mayor Barrett. Now we'll hear from Dr. Ben Weston.
Thank you. Good afternoon. First, to our numbers, we have 11,397 confirmed cases of COVID-19 in our community and 355 individuals who have died. We're certainly seeing beautiful days, hot weather, and aside from being inside your own home, outdoors is luckily a pretty safe place to be with regard to the COVID-19 pandemic. The open air, the breeze makes person-to-person transmission of the virus more challenging. That said, you can still get infected with COVID-19 outside, and it's still important to remember to take precautions. So just as with any situation, you can think about 3 items we've talked about before: people, space, and time. So minimizing the number of people with whom you closely interact, ideally only those with whom you live in your house, but without question avoiding any large crowds, maximizing the space between those around you. And so for example, going to a beach or going to a park that is not very crowded might be fine, but certainly separating yourself from others by a minimum of 6 feet, and wearing your mask for added protection when out in public. And if you do have to pass by others on a path or on a sidewalk, keep your distance, but also minimize that time factor. So passing someone on a bike path is relatively low risk, while sitting with someone inside a restaurant is going to be much higher risk. Each of these precautions, as the mayor mentioned, are as important now as ever. We're seeing throughout the country states, frankly, going in the wrong direction in their positivity rates of COVID-19, and we see hospitals nearing capacity across the country. As we see much of the country, and indeed much of our state, seeing a higher burden of disease, there's no risk to think that Milwaukee County will not be affected, and that we won't start to see our numbers move in the wrong direction as well. That's why we must stay vigilant. So consider, again, people, space, and time. Wear your mask in public. There's no doubt that wearing a mask is less comfortable than not wearing a mask, and certainly warmer than not. But it remains a critical way to minimize the spread of COVID-19. I see a lot of people wearing their mask low, only covering their mouth and not their nose. This is not effective. I also see people wearing their mask lowered around their necks. This is clearly not effective. So wear a mask that fits snugly around your nose and your mouth. So please enjoy the weather, enjoy the outdoors, but wear your mask. And remember people, space, and times, and remain cautious. Thank you and stay safe. And I will pass it along to Commissioner Kowalik.
Good afternoon. Thanks, Dr. Weston. As Mayor Barrett noted, where we're at right now and looking at the city of Milwaukee, Milwaukee County, the rest of the state, the rest of the country, various regions where there is some loss of gains that we've made in our COVID-19 response. So we're monitoring this closely in our local area, and we know that that public-facing dashboard that the county has, as well as the city, ours is updated now weekly, where you're able to see how things are looking. If you look at the cases by day, if you check every day, you'll see like a variance. So you'll see kind of a peak, and then you'll see kind of it flattening. A lot of that has to do with how the data is being processed. The positive cases are normally processed first. So if you see like the positivity rate, it will be very high. But then as the negatives are entered, then that brings that positivity rate down, which is why it's better to look at a week versus looking at daily numbers. So we go with the 7-day average as far as looking at the progress that we're making in our community here. We also know that our gating criteria also had various checkpoints. So we were looking at where we were at, right? Like we went into phase 3, and then we had one red for one of our indicators at the beginning of the week. And we determined that because we had the one red, that meant that we couldn't look at moving forward at that point in time, that 2-week interval. So we added an additional week, and that was last Friday. So when we reviewed the data last Friday, we were looking stable. Remember, the gating criteria looks at being stable. If you're in yellows and greens, that you are clear to move into the next phase, which is what we did for phase 4, which takes effect at 12:01 a.m. Tomorrow, 1st of July. We are continuing to monitor and watch what's happening, because last thing we want to do is kind of dial things back. We also know that there's been a lot of feedback, and people are paying attention to what's happening. Since we have orders in the city of Milwaukee, it's our obligation to educate our community about what these mean. And we've been very gracious about how we are going about our orders. We haven't been heavy-handed on folks. We haven't been, the mask police or anything like that. We've been very gracious, but at this point in time, because we're looking at what's happening, the trends that are happening in other parts of the state and the country, we're going to have to be more aggressive with our enforcement. So I just wanted to make sure everyone understands what this means. So as a capacity still is capped at for the gathering, the lesser of the three, the 250, 50% now of building occupancy, or 1 per 30 square feet. So depending on the situation, that might not change your circumstances for your business. But if it does alter it a little bit, we are going to be checking capacity. So the health department will be monitoring this capacity. Remember, we have an order, it's not guidance. So it is something that we can enforce. Normally what we do is when we see a violation, there's a discussion, there's an education opportunity. And then if we see a repeat violation, then we move into some actual citations and things like that. We have received, and I said this before, we have technology now, so people will send us pictures, videos, various accounts, screenshots of social media and all of that stuff. So we do evaluate that. We do consider that to be evidence. And then we do move forward on that account. So just again, highlighting when you see violations of the order, please let us know so we can act on that. We're going to make sure that health department staff are more visible and out in the evening and over the weekend where we see some of the violations, or we have been told of some of the violations. But that email address is the CEHadmin, so ADMIN @milwaukee.gov. It's the same email address we've been promoting along the way. We also want to just highlight again the personal responsibility in helping to prevent the spread of COVID-19. And I know that there's a lot of energy around masks. As a public health professional and as someone that's high risk, I'm all about masks. So we just want to, again, remind people that wearing a mask, we were like, is for you if you happen to have the virus, to keep it from spreading to other people. But I want to twist that. I want us to look at the indirect way. So if everybody wears a mask, or more people can wear a mask, the people that can wear masks, that you are reducing your chance of being exposed to COVID-19, the more people that do it. So it's somewhat like with vaccination and herd immunity. You get more people doing it. There's a small amount of people that can't do it for medical reasons or whatever, but they're protected by having this groundswell of support. So I just wanted to again show the proper way to wear a mask, because as Dr. Weston noted, some people are, riding low. It's kind of like sagging your pants, or they're wearing it around their neck. And if there's viral material, you could be possibly giving it to yourself by touching the mask and raising it up and down. But this is my mask for today. It pretty much describes how I feel on most occasions. But you put it over your ears, and you don't touch the middle part, and then you fix your glasses or whatever. So this is a cloth mask. You can wash it, you can reuse it. We know that there's a number of initiatives that are handing out paper masks, and the material, the Mask Up MKE material. We want to make sure that there's access to more washable masks in the market. So the health department is working on that. And we will be circulating some health department branded masks in the near future. But again, it's just getting everybody out to understand our role and our obligation as Milwaukeeans to try to prevent COVID-19 infection in our community. And it's not just the business owners, it's not just government or healthcare institutions or first responders. If everyone takes a part of this and eliminates what the mayor was saying about how wearing a mask could be like a political thing, or at least some people are seeing it as such, which is the wrong way to go. We want to make sure we know that we can do something to help prevent the spread. So why are we not doing it? Political affiliations aside. So I just wanted to, again, just highlight the importance of wearing a mask and the hygiene piece, washing your hands, using hand sanitizer, because I know many of you are out and about. Also cleaning high-touch surfaces on a regular basis. You'll be surprised how frequently those things can build up. So you want to make sure that your doors, doorknobs, handles, things like that are being sterilized on a regular basis. And then, of course, just monitoring if you do start feeling under the weather. I know some people are very sensitive to allergies and things like that. it's best to just get tested. If you're an essential worker, you're more likely at risk for being exposed, so you should get tested on a regular basis. If you are participating in First Amendment activities, you should get tested on a regular basis. And then also, if you have people in your family that are high risk or over the age of 65, please consider getting tested for peace of mind that you're not exposing them to COVID-19 by being out and about and then bringing it back into the house. So the testing aspect is really important. Again, getting tested is not just a one-shot deal. You should get tested on a regular basis depending on your level of risk. And then again, as the health department, we want to just continue to promote safety during the season. We know it's warm outside and everyone wants to be out and about. But just over the weekend, looking at the beach and just being horrified with how much gathering and closeness there was, of course, minimal mask wearing, that we need to make sure that we are doing this in a safe way and that we're not going to be like the rest of the country or other parts of the state that are losing all of the gains, all of that staying at home, all of that stay at home save lives, and then us having to go back to the drawing board and move forward. So let's just do this the right way. Again, phase 4 order takes effect tonight. Very modest changes with this one. We still, again, have that, the lesser of the three, the 250, now 50% or 1 per 30 square feet. The youth summer camps or groups and child cares were 50%. That will go up to 75%. You may ask why. We do know that many people are required to go back to work, or they're being phased back into work. So we want to make sure we're providing some protection there, but working with our partners at the state, making sure child cares are on point with their sanitation and disinfecting, and that they're not allowing kids to come in that are a little under the weather. You know how it is. I'm a mom, so I remember how quickly an outbreak would happen at the child care center. So again, that's some of the major changes in phase 4, but for the most part, everything is pretty much stable. And then we'll be revisiting phase 5 and just what that looks like moving forward, because the way that the gating criteria is set up now, again, when you're stable, you're able to move into the next one, and we need to be more cautious. So we'll be revisiting that. So we just wanted to prime you all to know that there's some changes coming, and that we're continuing to evaluate what's happening in other areas to make best practice or considerations for the city of Milwaukee and Milwaukee County at large. Thank you.
Thank you, Commissioner Kowalik, for the demonstration as well as the important context and clarity. So we appreciate it. Momentarily, we'll hear from our final guest. And just a reminder to media, if you would like to ask a question of our guests, please let me know. Otherwise, feel free to put a question in the chat box. And lastly, we'll hear from our guest, Dr. John Fagnan. Thank you so much for joining us.
Thank you. First of all, I just want to thank Dr. Weston, Commissioner Kowalik, and Mayor Barrett for their really thoughtful. I'm an infectious disease doctor. I can attest that their messages is spot on. You know, there's a temptation to minimize risk and to relax, and this is not a moment to do that. So I really appreciate the hand hygiene reminder, the masking reminder, and then Dr. Weston's concept of people, space, and time. I think that's spot on. People like me are the people you'll meet if you end up in the hospital and having to deal with COVID. I also want to say thank you to the city and the state health departments, as well as the National Guard testing sites, because they've done a terrific job really ramping up testing in a way that's, I think, affected our ability to effectively manage the epidemic locally. And I also wanted to say that, you know, as the National Guard sites step away, that there's a lot of capacity that we've developed in the health systems to do testing, and we really need to get the message out there that the health systems, the adult health systems, children's, and importantly, the federally qualified health centers and safety net clinics all have much greater capacity to do COVID-19 testing now moving forward. So we stand ready to test, you know, anybody that really needs to be tested. I would remind you that, you know, you don't have to wait until you're really sick to get tested. The symptoms can be very mild in some patients, and it's important to know your status. One thing that's really important, I do HIV care as well, is anytime you know your status, you behave differently. And so knowing that you are or are not infected, knowing that that little bit of a sniffle is allergies versus COVID-19 will be really, really important moving forward. So the symptoms, not just waiting until somebody has high fevers, severe shortness of breath, cough, but remember also those more subtle symptoms of loss of taste and smell. And then and some diarrhea, sore throat, muscle ache, fatigue, some of these things. We all are really ready in the health systems and the safety net clinics to provide testing. So I just encourage those listening to convey the message that the health systems, all of them, have capacity. They all have ways on their websites to direct you to get an appointment, come in, get tested. If in doubt, get tested, because that will be key to understanding how we manage the epidemic moving forward.